Watching here. Thank you, Mark. As violence escalates in our communities, we even see it in hospitals, a place of healing and care. Today, a Duke leader is speaking out after an assault this week on a Duke Health employee, an example of workplace violence faced by healthcare workers. WRAL's Chelsea Donovan reports.
Soon these orange signs will be plastered all over Duke Hospital walls and primary care facilities.
I have never witnessed this degree of incivility ever.
The system's COO, Dr. Craig Alabanese, speaking out after this man, 47-year-old Stanley Scarboro, is accused of physically assaulting a Duke Hospital staff member. That happened on Thursday morning. That healthcare worker sustained significant injuries, according to a police report. The atmosphere in our society is trickling into hospitals, among other settings, says Alabanese, and COVID and a lack of access to mental health care has exacerbated it.
Social isolation that stems from that, the sickness, mortality, lost jobs. We have a looming recession now.
According to the American Hospital Association, 44% of nurses reported experiencing physical violence and 68% reported experiencing verbal abuse during the COVID-19 pandemic. Stress then trickles into a hospital setting where there's already an emergency and emotions are running high, people in pain, isolation, or dealing with devastation. That creates more risks.
They deserve to feel safe here. But, this is unfortunately a risk that we have everywhere in the country right now.
Duke Hospital's also making fewer entrances available for visitors, more visibility for their security officers, and providing additional emergency alert resources, especially for those dealing with behavioral health issues, all in light of the recent violence.
We're doing all we can to minimize risk.
In 2015, our state passed a bipartisan bill that makes it a felony to assault hospital personnel and healthcare providers who are providing or attempting to provide healthcare services to a patient in a hospital.
That was Chelsea Donovan reporting.